Hi, welcome to WakeTV. I'm your host, Alice Avery. Spring has sprung here in Wake County and we have lots of great stories to tell. Stay tuned. With the news that Wake County is opening up COVID-19 vaccines to all adults older than 16 starting on April 7th, Communications Director Dara Demai sat down with our Pharmacy Director, Dr. Jason Whitus, to go over a list of frequently asked questions about the vaccine.
Hey everybody, I'm Dara Demai, and welcome to our Wake TV in-depth interview. Today we are lucky enough to have Dr. Jason Whitus with us today. He is the Pharmacy Director for Wake County Public Health, and he's also one of the leaders that is spearheading our vaccination effort. So welcome to you.
Thank you. Thanks for having me.
We're so glad to have you here, Jason.
Absolutely.
So I'm sure that many of our viewers had no idea we even had a pharmacy or a pharmacy director, much less one that is so involved in our vaccination effort. So talk about your role in that and help people understand what it is you do.
Sure. So specifically for COVID response or any emergency response, my primary responsibility as the pharmacy director is to be in charge of all of our medical countermeasures, or SNS, Strategic National Stockpile from the CDC. So I work pretty closely with Human Services, disaster preparedness, as well as our emergency management partners to ensure that everyone has access to medication in the event of an emergency. My day-to-day job, though, I oversee our pharmacy here at Wake County Human Services at Sunnybrook, as well as our regional centers pharmacies as well, and all the purchasing, buying, regulatory compliance, all the fun things that go along with normal pharmacy work.
Well, we are very lucky to have you because you do a great job with all of that.
Those are very nice words.
Well, I mean it for sure. You know, on this day that we're taping our interview, we have hit a very exciting milestone. We vaccinated our 100,000th person here in Wake County. Yeah. As someone who's been involved with this effort from the beginning, when we were having, 96 doses available or 960 doses available, How does it feel to finally reach this point?
In such a short period of time, relatively, it is such a great relief, A, and B, so exciting because we have come from, to your point, I hope we get 975 this week. I hope we don't get skipped this week. I really want 2,000 doses. To now we're getting close to 20,000 doses a week in. And the fact that we're at 100,000 people, and especially that we've been able to target and had some of the most vulnerable populations vaccinated as quickly and as rapidly and efficiently as we have been able to, it's astounding. And it speaks to all the hard work of the team to get the job done.
Yes, total team effort. There have been hundreds and hundreds of people involved across many different groups to make this happen, for sure.
Complete county collaborative effort.
Yes, we are so proud of everyone for working on that.
Yeah.
And we have made awesome strides, but we still have some work to do. We still have hundreds of thousands of people that we would like to get vaccinated. So what is that magic number that we're trying to hit to reach herd immunity, and how long do you think it's going to take us to get there? Sure.
So typically we want to go for a target of 70% of the population. So right now the vaccines are only approved for people 16 and older, so we're still going to have a margin of children, young people in the county, but that's going to be a county of our size between 1.1 and 1.2 million people. The minimum is going to be around 825,000 people, right? So we have a long way to go before we reach that. I think we'll probably get there mid-June. Sometime in that time frame, based on our current allocations, more doses becoming available, potentially more vaccines becoming available and approved. So there is at this point, doesn't look like there's a shortage of vaccines or any manufacturing issues. All those have sort of worked the kinks out, and we're getting more and more doses every week. So that means more and more people vaccinated, as well as our community partners. So the hospital systems, community partners are also gaining access to the vaccine at a faster rate. And that's more and more people vaccinated. So I really think that our timeline matches the federal timeline, which is around June.
That is so exciting.
Yeah, for the minimum of herd immunity. Ideally, we want 80, 90, 100% in an ideal world, but 70% is the target.
And
minimum.
What's so special about that 70%? Why is that the target, and what will happen that benefits the community when we get there?
Sure. So what we have now is community spread. So we can't really do contact tracing because it is widely spread COVID-19 is just widely spread in the community. Once we reach to 70, 80%, we can go back to contact tracing, isolation, knowing exactly, okay, I interacted with Jason and I got COVID from Jason. I'm unvaccinated. He was unvaccinated. We didn't follow the 3 Ws. And we can go back to that contact tracing and then 10-day quarantine at home, and then get rid of the spread, basically. What we had hoped at the beginning, but unfortunately, COVID spread so quickly and so easily. And that's one of the concerns as well, and why the rush to getting vaccinated as quickly as possible is because we are not sure about variants, right? So getting vaccinated and having as many people vaccinated as quickly as possible helps decrease the risk of community spread and variant creation.
Most definitely. Now, you said, we would like to see that 80, 90, 100% vaccination. We know there are some people out there who are still on the fence. One of the things that I've heard from people who are questioning whether or not they should get vaccinated is every year when I get the flu vaccine, I always get the flu. So I stopped getting the flu vaccine. I'm afraid that if I get the COVID vaccine, I'll get COVID. What can you tell them to help assuage those fears?
Sure. So first, I'd like to say the side effect that most people feel after they get the flu shot is their immune response. And that's what a lot of people are saying is their side effect to the COVID vaccines is their immune response, right? So I think that'll help dispel some of those fears, especially I'm more worried about people getting their flu vaccine. But there is no active or inactivated virus in any of the currently approved vaccines. It is literally just an RNA strand or a DNA strand that is part of the sort of genetic code that just gives your body the messages of how to fight COVID and prevent it from sort of attaching in your body via those little spike proteins on the outside. But yeah, there are some side effects, and most subside within 12 hours. And similarly to the flu vaccine covers those strains or variants that are selected every year. It looks like currently the vaccines that we have approved in the United States all have some efficacy against the 3 main strains or variants that are being spread. So it is critical to get a vaccine as quickly as possible when you're able to.
Another concern that I've heard from some folks is, this vaccine, or all these vaccines were developed so rapidly, there couldn't have been enough time to do the proper testing, run it through the proper protocols. What do you say to those folks to help give them some confidence that the vaccine is safe?
Right. So all the studies were done in normal FDA regulation. They have this normal sample size, same statistical analysis, same post-marketing surveillance being done. The vaccine adverse event reporting system, so you can still track all the adverse events that might be happening. But if you think about it, just in our county alone, we're at 100,000 just from the amount that we've administered. As a county as a whole, we've administered a little over 275,000 doses. And the adverse events are very minimal to none. So that shows and efficacy, right? So cases are dropping. Is it because people are following the 3 Ws, no holiday gathering, things like that? It also has largely contributed to the vaccine. So that's a huge lived experience knowing I'm following CDC guidelines. I can be in a household with someone else who's vaccinated and we are not at risk of contracting COVID. It's a pretty amazing place to be in a year. I understand that there are concerns, but all the guidelines are followed, all the safety guidelines are followed, the studies are done properly, all the surveillance is being done. So I actually cynically think it's the opposite. Why do most drugs take so long? Not versus this, because it proves that we have all the things in place to get medications, vaccinations approved quicker. So what does that pipeline look like in the future for us being able to approve medications that are life-saving for other things in the future?
Oh, that's really interesting. I like that perspective. And you're practicing what you preach too. I mean, you've gotten vaccinated twice,
Correct.
as have I.
Yeah.
And did you have any big side effects?
No, so I was first in line. I had to put my money where my mouth was and say that if we had it available, I'd go and get my vaccine. So I got my first dose on December 22nd of Pfizer. 3 weeks later, I got my second dose. After the first dose, I felt a little bit tired, slight headache. My arm did hurt, but I didn't move it like the nursing staff told me to move it. The second shot, I moved my arm, so didn't really have that arm pain, injection site pain. I did get a needle stuck into my muscle though, so that would make sense.
Right.
But after the second dose is when, especially of Pfizer, you generate such a large immune response because you have some of that active immunity. So your body is generating a larger immune response. I felt kind of tired, exhausted, again, headache. Nothing that a course of Tylenol, one dose of Tylenol sort of knocked that out, and within 12 hours, I was back to normal. It also could have been because I would work 12, 14-hour days
Right.
at that time, so I've been really, I haven't really been treating my body the best way, so definitely rest up and rest afterwards, and I would recommend that for any time you get any vaccination, because you're generating an immune response.
Yeah, definitely. That's good advice. So there are so many different kinds of the vaccine available. We've got Pfizer, as you mentioned, Moderna, which is the one I got when I was vaccinated. We have AstraZeneca coming online. We've got J&J, the single shot. The Novavax is in process. So what do you say to people who are interested in vaccine shopping because they've heard all this buzz about, this one's higher, rated in efficiency than this one, and should they be shopping for one particular one, or is it just get the one you can get?
So right off the bat, I recommend get whatever shot is available to you at that time. So if you are at CVS and can make an appointment at CVS and they have Moderna, get Moderna. If you come to us and we have Pfizer, get Pfizer. If you go to WakeMed and they have J&J, get J&J. Because of the fact you can't compare them head to head. They were all done in different studies, similar types of studies, double-blind, placebo, all those buzzwords that you hear when studies are conducted, but they were conducted at different points during the pandemic. So Pfizer and Moderna were done mostly in their phase 3 trial, large scale, towards the end of 2019. J&J's, for instance, was done beginning of that end of the year into 2021. So that really showed different strains or variants. So that's why we have actual real-world data to the J&J product. It's also one shot. So within 28 days, you're at 75, 80% efficacy against the wild type strain that's here currently in the United States. So that's why it's really hard and difficult to judge them against each other. So that's why the best thing is just to get whatever's available, because they're all effective and they all exceed the minimum standard by the FDA.
And so when you hear on the news all these scientists with a lot of letters after their name using fancy science words about, this one's 93% or 94%, what is the bottom line for people to know about how effective any of these vaccines are going to be in preventing health issues if you do contract COVID? Right.
So the benefit of the vaccine, we know what the side effects are. The beauty of most vaccinations is that long-term side effects typically are not a thing, right? So they work really quickly, you build up an immune response, you feel kind of cruddy for a day, but really within the 3-month time frame, we're going to know if there's any kind of long-term side effects, right? And that's what the study showed, and that's what we're seeing in real life now. With COVID, we do not know what the long-term side effects are, and by side effects, I mean loss of taste and smell, reproductive issues, headaches, breathing issues, cardiac issues, brain function. There is a treasure trove, unfortunately, of different types of ways that people experience COVID and potential long-term effects. So that's why it's critical that we get vaccinated as quickly as possible with whatever vaccine's available.
Definitely. So moving on, our rates of positivity of COVID have been going down. Here in Wake County, we're seeing fewer hospitalizations, which is great. We're seeing fewer deaths, which is great. Can we attribute those to more people getting vaccinated, in addition to doing some of those other safety precautions like the 3 Ws?
Sure. So yeah, 100%. So the vaccine itself, even if no vaccine's 100% effective. Right. So even if you are to contract COVID with the vaccine, and really the purpose of any vaccine is to lessen the severity of what you're going to come down with. So if you get COVID, but you got vaccinated, you're going to have an asymptomatic or mild case. You're not going to have to go to the hospital. You're not going to be put on a ventilator. You're not all those big scary things that are associated with COVID that there are real risks with, and at much significantly higher rates than you don't see it in a vaccinated person, are reasons enough just to get the vaccine. So it's critical that we get vaccinated to help ensure that we're living longer, not having those long-term side effects, and preventing death. That's the main purpose of the vaccine. And I think that's attributed, and I also think it is the 3 Ws and people listening and following the guidelines. But in our populations, especially in our elderly population, 65 plus, we've seen that those death rates, positivity cases drop dramatically, and that can be attributed to the vaccine.
That is awesome. And that was a perfect segue into my next question. The senior population, those 65 and older folks, are doing a bang-up job getting out there and getting vaccinated. Now it's easier because they were at the beginning of the list in earlier groups.
Yeah.
So, but really they're kind of a role model for the rest of our age groups who don't have, those compounding health issues and don't have the age element to them. Moving forward, which group do you think is going to be hardest to convince to get vaccinated?
Yeah. And kudos to our seniors, because they have done a remarkable job and sort of led the charge and made our job in public health a little bit easier. But I think first and foremost, kids, because it's not approved at this time for anyone under the age of 16, and only one of the vaccine products is. So those studies are happening now. So I think making sure that all the information and being as transparent as possible with parents about getting vaccinating their children. And then I think middle-aged people, because middle-aged people might not have lived through a time where there was a vaccine-preventable disease and you need to be vaccinated. Our seniors, some of them have lived through times where measles was running rampant and mumps were running rampant, and polio, so they lived those and saw their friends and neighbors die, saw the benefits of vaccine, and we have been lucky enough not to have any of that. And now we're in the age where it's our time to step up and get vaccinated to help prevent the spread of COVID-19. Mm-hmm. It's preventable. We can stop death in serious cases. So we have to do our part for society.
Mm-hmm. Absolutely. So supplies, you mentioned earlier in the interview, is very important. We can't vaccinate people if we don't have the shots.
Right.
So you're feeling good about our outlook from now through the summer till we can hopefully hit that herd immunity. You're feeling good?
Yeah,
we're going to have it.
I'm feeling really good. Pfizer has come online with additional dosing. Moderna's looking like it's always been a steady flow throughout. J&J, while it's still relatively newly approved, we're going to be getting more and more doses through the month of April. So it's really exciting to see that. And then as more vaccine candidates get approved and come online for under emergency use authorization, we're going to see more and more of those vaccines available. And that's why it's important just to get whatever one is offered to you at the time, because that's one less case or chance of COVID infecting someone and spreading it.
Mm-hmm. And along with getting greater supply, we're seeing it available in more places. At the beginning, it was us and it was the hospitals, and that was pretty much it. And so now, we're able to give some to some of the local pharmacies. We're able to give doses to some local healthcare providers, which helps kind of broaden out the availability. So with people who are, as we move into group 4 and group 5, if they're looking to make an appointment to get a vaccine, should they try to cast the widest net possible and sign up at all these places, or should they just focus on one and try to get through that?
Yeah, so unfortunately, it's still not a top-down organized process, right? So it's not a federal sign-up and they can sort of direct what's available where. So I recommend you sign up everywhere. That's what we've been saying the whole time. So please sign up on our website. Please sign up on hospital system's website, your doctor's office. So if you go to a primary care doctor, they might be getting direct shipments now and offering it. So make sure you check out their website. CVS, Walgreens, community pharmacies, independent pharmacies. This is where I was hoping that we'd be earlier on in the process, but knowing the logistics behind the vaccine, it is more and more promising seeing that some of these smaller locations are capable of doing it and stepping up and making accommodations. If they weren't able to a month ago, they're now able to. So it's really highlighting and giving confidence to the state as well to send directly allocations to our partners through our Transfer Wake, Vaccinate Wake program. By us sort of showing that these smaller providers can do the vaccine and vaccinate people and get hundreds of people in and out in a week, that has given the state confidence to directly ship to those providers. So we're seeing a lot of people that we've originally started a transfer with have just been getting directly from the state. And that's been huge for in some of our rural communities, or some people just trust going to their own doctor, right? some people don't want to get stuck by Jason, the pharmacist. They want to get stuck by, their doctor at their office. So we have to meet people where they are. We have to meet people where they're comfortable. So like I've been saying since December, I hope to see it everywhere, including your local grocery stores, just like the flu shot, where you just go in, you need some ice cream, and then you also get your COVID shot. So
yes, that would be great.
Yeah.
Well, that's a wonderful recommendation. And my last question for you today is, once the world starts to get a little bit back to normal, after we hopefully this summer get hundreds of thousands of people vaccinated in our community, we can open up a little bit more and a little bit more in a very safe and measured way, as the governor's been saying. What are you looking forward to the most that you haven't been able to do in the past year?
Without a doubt, it's having friends and family over, right? So it's been a tough year of quarantining in place, staying only with my household, which is just my wife and my dog. So having friends and family over, enjoying something that I have not been able to do, which my wife and I used to love, going out to restaurants. We have lots of great restaurants here in the Triangle, but going out and exploring all of those again, not just outdoors, but also indoors. And lastly, which I think it's a little too early now, but I can hope and dream that we get there sooner, is traveling. That's the thing that I love the most. And by getting vaccinated, that opens up that door. And by more and more people getting vaccinated, that allows for safe travel and then safe business. And those are the things I'm most excited for.
Yes, I'm right there
Interacting
with
with people, no more virtual Zoom hugs. Actual hugs.
That's right. This extrovert is missing people for
exactly.
sure.
Yeah.
Well, thank you so much, Dr. Whitus, for coming on today and talking about all of this with us.
Yeah, I really appreciate it. Thank you.
Yes, thank you. And if you are interested in getting your vaccine through Wake County Public Health, we've made it very easy for you to do so. If you have access to the internet, just go to our website. It's wakegov.com/vaccine. Or if you'd like to speak with someone in person, you can call 919-250-1515, and one of our customer service representatives will help you. In the meantime, please remember, even if you've gotten your shot, it's important to practice the 3 W's. That is, wash your hands frequently, wear your mask, and wait 6 feet apart from others.
Only 1 in 5 people recycles in their bathroom, so Wake County is making it easy to get started. If you sign up for our bathroom recycling initiative and agree to take a survey, we'll give you a free 3-gallon recycling bin for your bathroom while supplies last. For more information, visit the website on your screen.
We want cake! We want cake! We want cake! We want cake!
You remembered to get the cake, right?
I thought you were getting the cake.
We want cake!
What? No cake?
Things are better when you plan. Learn more about what we're planning at planwake.org. Are you hosting an event but don't have a convenient way to collect trash and recycling? Wake County is excited to announce a new event recycling program that's free for residents. Whether you're hosting a private event, wedding, neighborhood party, or even a festival, these portable stations include composting, recycling, and trash bins. To learn more about how you can reserve an event recycling station for your next gathering, visit wakegov.com/event recycling. The Wake County Public Library system has gone late fee free. No more late fees will be charged on overdue items. Existing late fees have been cleared from all accounts, giving everyone a fresh start. Just remember 3210. 3-week checkout period. 2 courtesy renewals, 1 happy customer, and 0 late fees. Learn more at wakegov.com/late fee free. Did you know 1 in 30 baby boomers has hepatitis C? People born between 1945 and 1965 are 5 times more likely to have hepatitis C. Hepatitis C can hide in the body for years or even decades and can cause cirrhosis, cancer, and even death. The good news is hepatitis C can be treated. The first step is to get a simple, free blood test. Don't be a statistic. Visit wakegov.com/hepc today to schedule your free blood test.
Get the timely and accurate information you need to stay safe if there's an emergency in your area.
Sign up for Ready Wake alerts and Wake County will send you important notifications by text, phone, or email, whichever way you choose. Whether it's severe weather, a missing person report, or a neighborhood evacuation, stay in the know with Ready Wake alerts. Learn more and sign up at readywake.com.
The Wake County WIC program is excited to announce a major new development for the distribution of WIC benefits. eWIC offers a simple, safe, and convenient way for WIC clients to use their food benefits. The brand new eWIC cards replace paper food vouchers and work just like debit cards at the checkout. When you get to the register, swipe your eWIC card first to pay for WIC-allowed foods. For the first time, eWIC allows clients to buy as little or as much food as they need during each shopping trip. You can even check your benefit balance and identify WIC-approved products on your smartphone while you shop. To learn more about eWIC, please call 919-250-4720 or visit wakegov.com/WIC.
On March 16, 2021, more than 50 Wake Tech students signed on the dotted line with local employers as the first students to be hired as apprentices through the WakeWorks apprenticeship program. The program was launched in 2020 with up to $500,000 each year from the Wake County Board of Commissioners. The program is designed to expand apprenticeship opportunities in skilled trades and technician programs where demand for workers is high. WakeWorks funding covers tuition, fees, books, uniforms, and tools for the apprentices who will also receive at least 2,000 hours of on-the-job training and 144 hours of related classroom instruction. Apprentices will also earn a paycheck in the process and eventually be awarded a Journey Worker certificate, verifying their skills and qualifications in their trade or craft.
This is a great way to customize train your employees at your place of business. The apprentices actually do their on-the-job related instruction at Wake Tech and the on-the-job training component at the place of employment.
Wake Tech offers the uniforms, tuition, anything that you'll need. I believe it's the first year, and then when you secure employment, your employer will cover the rest.
I was like, man, this seems too good to be true. I was like, I don't know about this. Talked to my dad about it, and so we went up there, and yeah, they're paying for the school and then paying me on top of it. So I got to pay for my books and my tools, but other than that, everything's paid for.
The demand for services will be there, and keeping up with that demand and hiring that pace is significant. So we got to find additional innovative ways to develop the future workforce that we will need to care for the community.
Get the timely and accurate information you need to stay safe if there's an emergency in your area. Sign up for Ready Wake alerts and Wake County will send you important notifications by text, phone, or email, whichever way you choose. Whether it's severe weather, a missing person report, or a neighborhood evacuation, stay in the know with Ready Wake alerts. Learn more and sign up at readywake.com.
That's all for this episode of Wake TV. Keep up with all the latest Wake County news by visiting us online at wakegov.com/news, and be sure to follow us on Facebook, Instagram, Twitter, and YouTube so you can always stay in the loop. We'll see you next time.